Wow, this feels so good to be back. We are pumped and ready.
You know what? We're probably like, wait a minute, she doesn't look like Esther. What's going on here? Guess what? We have a new member joining us today. Esther, unfortunately, was not able to make it.
Right.
Esther, we hope to see you soon.
100%.
Future episodes, always a pleasure to have you join us.
Absolutely.
But today, actually, we have another fabulous guest host, which I had the pleasure to work with.
Wow.
Doctor, she's a real doctor, Dr. Alina Yushuvayev, who will in a few minutes tell us more about herself. And we're going to ask her questions related to the medical field. So if you have any specific questions and we can get to answer it while we are live, post your questions. We will try to get to as many as we can. If we skip your question, we'll try to address it after the show. Avi, introduce yourself, please.
Hello, everybody. First of all, I want to just say I am so happy to be back here. A big shout out to Esther. Esther, we miss you, so come on back. And hope to have you on our next show. But I'm very excited to be here today to have this very important conversation. And I really came to just learn from Doc and from Yocheved, because these are two very powerful human beings. So I'm honored to share this platform with you. I am a licensed clinical psychotherapist. I have a private practice where I see families and couples and children and teens and adults, helping them navigate through different challenges they have in their life. A lot of you probably know me, the guy with a lot of pets. It's funny when people say my name, they're like, oh yeah, that's the guy with the dogs. Yes, I have a lot of different animals, but those are just one of the tools that I use to be able to help people during the challenges.
And yes, he's married, for anyone who's questioning that.
Yes, I am married. And Yocheved, over here, our showrunner, please tell us, who is Yocheved? For those living under a rock and that don't know.
So I'm a physician assistant. I have 4 children, and I love to do motivational speaking on the side. So I enjoy hosting events. So for those of you that don't know, that's what I do. In 1 second, I'm going to let the doctor introduce herself, but I just want to make sure that I can see your comments. So I'm just going to get myself settled so that I can see the comments.
Angelina is saying hi, Alina.
Oh yeah, so I'm gonna refer to the doctor as Alina, so don't mind me because we're friends actually. So no disrespect. We are going to this is a very, very chilled out show.
So wait, so we just met, so I still have to call her doctor. So I will be calling her doctor for tonight. And Yocheved, do I call you, maybe I should call you Mrs. Dekhkanov or Mrs. Yocheved?
No, Yocheved's good enough.
Yocheved is good enough.
Yes,
okay,
yes,
fine.
yes. So introduce yourself. Tell us what you do. We'll give you her contact information. I'm sure a lot of you will, if you're looking for a new primary care doctor, I will give you the way that you can reach out to her. Let us know what you do.
Hi, everyone. Thank you, first of all, to Yocheved and Avi for having me join the show. I'm very honored. I'm a medical doctor in internal medicine, and I practice primary care. I worked together with Yulia in the past, and now I have my own office, and just started my own practice. So thank you so much.
We wanted to just say, well, first of all, welcome. We wanted to just say, we see the comments, we apologize. No yellow dragon fruit today, but we do have some other goodies. I do have to say, this tea is next level. What kind of you always make this good tea. What
raspberry
kind of tea?
tea.
Some raspberry tea. So cheers to everybody, and we are pumped to get this topic started. So what are we talking about
I'm
today?
going to start off with I have a bunch of questions, but I'm going to start off
right.
with the question that I think is going to jump us into this, because a lot of you will think, wow, that's an interesting question, and many of us can relate to it. And this question, I'm actually going to start this question off to Avi.
Okay.
And then I'm going to have the doctor answer the question.
Let's see.
What do you do if you think your family member has a psychiatric condition? You think they need to see a psychiatric doctor.
Okay.
They're not acting all that 100%. But the minute you say, hey, you got to be on medications, you're screaming all the time,
oh, wow.
you're very depressed, you're eating me alive, we have to figure this situation out, and then they say, what do you mean? You have to see the psychiatric doctor. I'm normal.
Yeah.
What do you do in this situation? Avi, let's start with you.
That's a big one. I think actually what you are describing, there's something called syntonic and dystonic in the mental health field, is when a person knows they have a problem, right? Like, for example, when a person has an anxiety disorder, right, or they have depression and they don't feel good and they're aware of their problem and they feel like I need to go get help, or possibly I don't want to get help but I know I'm not doing okay, that's one category. The second category is when they're really not aware of their behavior. Like, for example, a narcissistic person or somebody with dementia, right, where they feel like they're normal, like everything is okay in their life. They don't need to go get help. You need to go get help, right? So that's where it can be definitely challenging. So a psychiatric doctor, if somebody, and again, of course, I don't want to overstep my boundaries, and we have a doctor over here, but if somebody's, having hallucinations and delusions and this type of behavior, definitely you want to go see a doctor. If somebody's having challenges in their relationship, or difficulties with being able to express themselves, or having some depressive type of feelings or anxiety, to be able to go see a therapist can be a more suiting, I think. But Doc, that's for you.
So I'm going to elaborate a little bit more for the doctor. So
Yeah.
let's say I'm coming with my family member and I'm saying, doctor, I'm telling you, let's give an example. My mother or father, they're not acting like themselves. I really think that they need help. And then you have a patient in the room and the patient says, no, I'm fine. My child's totally out of board. How do you, as a doctor, now you have a situation here. I understand we have HIPAA and privacy rules and all that. What would you do in a situation where somebody thinks they need to take their family member to see a doctor, but the patient is refusing to get help?
Yeah, that's a very good question, and it's very, very common to see that. You have to explore the situation a little bit. What are, why the patient is refusing to believe that they have a problem. Sometimes they are aware, but they're blocking it off. But also the intensity of the situation, because sometimes they can pose danger to themselves or to other people. So sometimes you have to be very paternalistic in your approach. But definitely you have to talk to them, talk to the family, and just find common ground and see if maybe just a simple therapy would be a great start point before connecting them with the psychiatry. And I found that was always the easiest way to approach that.
I like very much what you said. A lot of the times people feel that once they feel like their life is going to be different, once they kind of come to terms with them having this difficulty or this new challenge. Like, for example, let's talk about seniors, right? Let's say you have a senior parent, who are pretty independent. They can cook for themselves, bathe themselves, and do their regular activities of daily living on their own. And all of a sudden you're noticing that your parent had multiple falls, or your grandparent had multiple falls, and they're having either slurred speech, or they're becoming more forgetful, and you're starting to see this pattern of behavior, which is very questionable. A lot of the times, in Doc, you can, and Yocheved, you both can correct me if I'm wrong, but a lot of the times they may not want to go get help because they fear that it will change their normal way of living, what they're familiar with. Now, if they do go get the help, or will be going into a nursing home, or will be having to be hospitalized, they're very afraid. What are your thoughts?
So, maybe I'm a little off topic, maybe not. So my approach, in addition, I'm just adding, in addition to what both of you just said, if a patient feels that they are not needing medical help, especially in the psychiatric condition, the first step that I take personally is to have a communication. I don't jump into diagnoses. I try to gain this person's trust in me. I'm not here to treat you medically. I'm not here to put any labels on you. I'm trying to now just help you. And I also want to make sure, because a lot of times I find the reason, especially in some cultures, it's a cultural thing where patients are almost like, it's embarrassing, I'm normal, there's nothing wrong with me. To make this patient aware, number one, everything is confidential. So whatever you will be on won't be going anywhere behind these doors. It's a confidential thing. nobody needs to know it. And number two, to make this patient realize that actually it's more common than you know, and it's not because something is wrong with you, it's age. It's a factor. Like I had a patient today, and her father passed away a couple of months ago, and when I said, how are you feeling today? And her response to me kind of was worrisome, because the response was, I'm feeling okay, but I would be better if I actually got to see my father. But I know her father's not here anymore. So that was a little bit like iffy. So you almost want to develop a relationship where you are empathizing, but you're also holding your ground and saying, by the way, I'm so sorry for you. We all go, and it's actually better if your father went before you, because that's the natural process of life. We actually hope that our parents leave before us. That's actually how we want it to be in life. That's how I would approach it. But let's take it a step further. And this is let's now go to a different medical condition. I'm going to let you answer it first. Let's say you have blood work. You get blood work back. And you notice, and I'm really specifically asking this question because I think a lot of viewers need to hear this from my experience. And you get the blood work that the patient has diabetes. Now, it's not just diabetes, because a lot of patients suffer with diabetes. As medical professionals, we actually determine how uncontrolled, how bad the sugar is based on blood work, based on a marker. There can be a 6.5, there can be a 14, there can be a 10. This is medical information. And you realize that the patient's diabetes is uncontrolled. The A1C is over 10. So you know that definitely requires some medical intervention. Now, the doctor says to the patient, hey, your sugar is very high. Oh, doctor, I haven't been watching my diet. Great, that's perfect. But now we need medications in addition to diet. The patient goes home, talks to their family member, and the family member basically says, no. What medication? Everybody has diabetes. I'm going to tell you other ways of treating it. That could be perfectly fine. We agree. There's other ways of treating it. But what if this patient also has other medical problems, and this family member giving advice doesn't know that this particular approach is dangerous for this particular patient, and your patient decides not to follow a treatment plan? What are the risks of that?
Yes, this is a very serious situation.
That's a big question.
Very challenging situation. And it definitely involves a multidisciplinary team to help. Sometimes the doctor by themselves cannot help this situation, so they do call specialists, dietitians, people to work with them. But definitely you have to tell the patient what stage of the disease process it is. You have to explain the disease process. Is it advanced disease or beginning stages? And you kind of give them information, and you give them options, different options. And you kind of have to sort out, what's important to them and what their fears are, and you kind of have to work with them together to get to the goal as best as you can.
Yeah, I think also what Yocheved, what you were saying in the beginning, was establishing rapport, meeting the person where they're at, and this is really the first stage, which doctors do this as well. Before you can get to the diagnosis and what's going on and how they should change, you really want to level with them, right? A lot of the times it can be very difficult for a person to come to terms with what's going on or hearing their diagnosis. So before we want to kind of change their attitude and change their mindset, we first want to be able to empathize. A lot of the times here, and I know some of the questions, we got a question from Mr. Romashka Davidov. Take it from me, and I'm not a doctor. Most of the clients are living in denial, and it's almost impossible to change their mindset. That's a very good point. A lot of the times, people feel like when they go to a medical professional or a mental health person, they are going to want to change their mind. A lot of it is really understanding where they are coming from, understanding why they're so hesitant to take different protocols, to take different steps to change their health or to change the way they view mental health. A lot of the times there's this stigma that why do I have to go to therapy? I'm not crazy. There's nothing wrong with me. A person doesn't have a coach like a person who plays a person who's an athlete, right? They don't have a coach because something is wrong with them. They have a coach because a coach is there to kind of check out all their blind spots, to see how they can improve and how they can make their life better. And in reality, this is really what a therapist does. I mean, I know a doctor is more coming in from the medical standpoint, so maybe you can share a little bit from
very
that
often
area.
I do get therapists involved in care because I feel like they can connect to patients on a different level, and not everybody understands this medical jargon, so leveling off is always the best thing to do. And just getting extra set of hands, definitely,
You were talking about like a multidisciplinary team.
Yes.
That is definitely very important. Like you said, a dietitian, having a dietitian, talking about, like you were saying, diabetes, right? Talking about a meal plan. A lot of times I used to work in the past, I used to work with alcoholics, seniors who were alcoholics. So people over the age of 60, 70, 80, 90-year-olds who were drinking alcohol. And a lot of the times it happened when they went to an event, a party, or how do you say a yeshua in Russian, in English?
A eulogy.
I don't know if it's a eulogy. It's like a memorial service, right? They went to a memorial service of a person who passed away, and especially when they're in that age group, it's so common that in a week they can go to 2 or 3 memorial services. And now they serve alcohol in these memorial services. So they feel like, I cannot deny the alcohol. I cannot say no because it's disrespectful. Because from where they came from, if someone offers you alcohol, you take it. Doesn't matter what you're going through. Do you know how many people I personally see with my eyes in these events who take medication and drink alcohol, which all doctors say, and please correct me if I'm wrong,
Very dangerous
do not
combination.
mix alcohol and medication, right?
Besides that, like a question for Alina, sometimes we know also that patients have liver disease, right? They may have end-stage liver problems. Besides the medication part, that this alcohol is actually, they may have a bad liver condition where they're almost in need of a transplant, or they have a hepatitis. And it's so dangerous for them to drink, but they're so ashamed to say, I'm not allowed to drink, because people are like, what do you mean you're not allowed to drink? You're a man, come on, drink.
Yeah.
Like, what are the dangers of drinking when you're not supposed to be drinking?
Yeah, absolutely. You can only say so many times, but ultimately it comes down to that, these cultural barriers, and it's very, very difficult. It's very challenging. I don't even know what to say.
You're right. I agree with you. It's when we're dealing with culture and with them having such a strong personality and them being able to say, why are you taking my only happiness away? Or why are you taking the thing that brings me joy and the thing that brings me like unity? Because when I drink, I don't feel as hyped up. I don't feel the enjoyment. I don't feel the excitement. So I don't want to stop. Or some of them will be in denial and say, yeah, I'm gonna stop. But it's very difficult. Even at the age of 60 and 70, it's so difficult with that peer pressure. A lot of the times now, when working with the younger generation, people in their 30s and 40s, they're starting to understand how they have to create a healthy, safe net for themselves, a safe zone, because if they don't, they will fall into that trap. And a lot of the times we say, if you're dealing with alcoholism, and again, we know what's going on in this past history with losing so many people to, unfortunately, whether it's drugs, whether it's alcoholism, whether it's doing other things, it's because of we need to talk about dealing with mental health issues. We need to talk about dealing with the crisis that's going on right now, the very big part of judgment that's put onto people. So being able to understand that everybody has their own healing journey and being open about it, the more we talk about it, the more it becomes normalized. Whenever we try to sweep things under the rug, that's when it's a problem. So for example, and I remember having this conversation, it was the most interesting thing. I mean, here I was, I think I was like right out of college, working with in a group, and I had like 60, 70, 80, and 90-year-olds in my group talking about alcoholism, and I had this like, it's terrible, I can't say this about my my client, but it was like this cute grandma, and she said that I'm really suffering all my best friends, all my friends died. My child died. My spouse died. Because think about it, she's 90, you know, so her kid was like 70 at that time, so also older. And they said, these people are dying. What joy do I have in my life? It's really hard for me not to turn to things like this. And it seems like, I know that we kind of took a turn in talking about alcoholism.
I don't know, maybe I'm wrong, but if somebody's 90, I'm like, you want to drink a cup of wine every night before you go to sleep?
That's
drink
another.
away.
So again, yeah. So maybe that. I don't know if we should generalize it like that, right?
I'm joking. I'm like,
it was
at
just
90,
a joke.
Make your decisions.
It was just a joke. It was just no, because what happens is, and again, you see, on the surface, it can look like, okay, you're 90, so drink. But also in a situation like that, a person can drink so much, and God forbid, it's a fall risk. And there's so many other
100%,
issues. There's so many other issues that come. So we want to definitely be able to talk about it and give them other tools and skills that they can apply in their life to kind of deal with that. And especially maybe Doc and Yocheved, you can talk about this more, is how people deal and how they cope with, and this was really the topic of tonight's live, is how people cope with finding out they have a medical or mental health diagnosis.
Right, so that's exactly what the topic was, and I was actually that was exactly the next question. Perfect. What do you do if you saw reports, and the report is, let's say I'm just gonna throw it out there, mammogram. This patient seems to have breast cancer. Now, you as the physician, as the doctor, are the first phone call to this patient, and you have to break the news that the biopsy results now after the mammogram were done are positive. What approach do you take with that?
Yeah, so I often have to do things like this, or they call me to have a conversation with the patient, how to deliver bad news. It can be challenging, but the first step that I always take is, first of all, I bring them in person, because you cannot have these kind of conversations over the phone. Mm-hmm. You always have to have them in your office in person. And the next thing you do is you try to assess their readiness to accept this information. How ready are they for this information?
What does that assessment look like?
So that assessment is, basically I ask them general open-ended questions, and, and I ask them, if the doctor has good news and bad news, how much of it do you want to know?
That's a great question, by the way. I love that.
Yeah, or do you want me to talk to your family members first? Mm-hmm. Just generally, just kind of.
Do you feel like these questions can scare them even more and be like, wait, what do you mean? What are you talking about, Doc?
Yeah, so sometimes, you have to say it in a less intense form. You start with the weather, you start with general conversations, but you all ultimately lead to these things. And most of the time they find it very benign. And, and I say, how much do you want to know, basically? Mm-hmm. And sometimes they don't want to know.
Wow.
Sometimes they don't want to know. So what do you do? So in that case, I say, okay, if you don't want to know, then who do you want to know? Who do you want me to tell exactly?
Wow. And do they say, please
sometimes they say, tell my daughter or tell my son, I don't want to know anything, and I'm okay with that.
Do you see that answer with a specific age group?
So a lot of it is specific culture.
Okay.
Like I see it in the Chinese culture. Sometimes
they tell their kids.
They want their kids to. They don't want anything to know about their diagnosis.
Wow.
In the Russian culture too, sometimes the kids try to hide away the information.
What do you think about that, though? Like, that's my next question.
That is a good question, because I do find that when the patient doesn't know the diagnosis and the kids are trying to hide it, oftentimes they go through a lot of anxiety and depression because they're waiting for all these tests to happen.
Who are you talking about? The patient goes through anxiety?
Yeah, like let's say if there is a diagnosis, the patient doesn't know, and the children of the patient tell me, don't tell mom, don't tell, don't tell them that they have cancer.
Well, technically speaking, and I think we're talking about ethics, like if they're alert and oriented, Are you allowed to withhold that information if the kids say, do not tell my parents?
So this is the tricky situation because it's very culture sensitive.
Okay.
And you have to be careful because sometimes it has gotten doctors into trouble.
But what about if you know this patient has a very weak heart and the family is like, don't tell my parent the news because they may actually have a heart attack?
Yeah.
That may be a situation.
Well, of course, that you want to take into consideration.
I'm really curious.
Right, you want to take that into consideration. But if it's causing, think about it this way: if it's causing a lot of anxiety and depression for the patient because the kids are withholding the information, then what kind of quality of life is the person even having?
Yes. So that's when I talk to the family members, and that's when I highly encourage them to have the conversation because I say they are going through a lot of anxiety and depression, and I've seen this a lot. So I highly encourage you to tell your family member about the diagnosis. So I put the spotlight on the kids or whoever's trying to.
There was a question that came up. It said, "How depressing is it for you to deliver bad news?"
Yeah. So I've had a situation. When I was working in Memorial Sloan Kettering, where it was like a 34-year-old woman with 2 small children with a terminal breast cancer. It was very difficult because she was so young, and it was very emotionally it was very tough when you have to deliver bad news to younger people.
Yeah, wow.
So it's hard because in a way you try to get your emotions out of the situation, but ultimately it does affect you at the end of the day. So sometimes even doctors need therapists.
And that's why therapists need therapists. Yes. So and people always ask, do you go to therapy? It's like, yes, absolutely, 100%.
You know what I have found also? Like, I talk to patients that have a lot of medical conditions, right? Like the ones who have the end-stage cancer, the ones that have the debilitating autoimmune disease. And actually, we're depressed for them sometimes, and we feel so bad, and we feel so sensitive. But it happens to be that those patients are the ones who are so grateful and so optimistic. It's almost like, how are you feeling today? And they're like, oh my God, thank God, God is great. I feel so amazing. And I see a pattern of that. Like, I would assume that those patients would be the ones who are like very down and very negative and feel so bad for themselves. I actually see, I don't know if you agree with me, but I see a lot of this where from those type of patients, I actually, as the medical provider, get strength. And I'm like, wow, if they can look at their medical illness with such positivity, and they're so grateful for another day, and they're so grateful that their pain scale went from 10 to 2, how much more do we have to be grateful for? So sometimes, even though we need therapy, speaking to those patients gives us so much therapy because we actually learn to appreciate what we have.
Yeah.
It says here, Diana Sionov asked, interesting, my parents don't want their kids to know what's wrong with them, not to worry us. So I have to dig out information, and then my mom gets upset. What are your thoughts about that?
That's very interesting.
So we do want to, so we do, first of all, I mean, Diana, to answer your question, it does seem like you're really concerned, and she's your mom, and of course we are concerned for our parents and their well-being, and we want to really know. I mean, off the record, if you can find out what's going on with her and try to support her, great. To a lot of the times also to bring it up, that reminds her that she's dealing with that, and possibly that's really what she wants to avoid. It may look like she's saying, oh, I don't want you to worry and I don't want to tell you, but possibly also this can be her way of coping, and it might be her defense mechanism trying to kind of keep the normalcy of home, right? Making sure the kids are fine and making sure, her husband is good and everything is just like it used to be, keeping the level of homeostasis. And that's really a lot of the times when people find out bad news, it's actually a defense mechanism. And this is a little off topic. It's a defense mechanism called intellectualization, which is when a person finds out they have a diagnosis They want to find out all the information of the diagnosis and not actually feeling what's going on, not actually crying, not actually grieving, making believe everything is just as it used to, kind of sweeping it under the rug. And it's definitely very important to allow yourself to grieve and to cry. And a lot of the times people say, have faith and have hope and you'll be good and everything will turn out, and don't worry, be positive. When you hear certain news, it's very important to feel. If you need to cry, if you need to talk with someone and be in pain for that moment when you hear, that is absolutely okay. We don't want to talk, we don't want to be in a place where we're suppressing. When you find out big news, like somebody has, God forbid, breast cancer or any other condition, you want to, first of all, number one, the main thing is with anxiety is the fear of unknown. A lot of the times people are anxious because they don't have enough information. And also, side note,
That's very true.
Stay off Google. Okay, because a lot of times people will go and they will Google things and they will hear this crazy story that happened to their grandmother's aunt's brother's sister's uncle who wrote something down on Reddit and now I think they apply it to themselves. And a lot of the times this is how people become a hypochondriac, where they hear these scenarios and they feel like, oh, that's what I have. I have this illness or I'm dealing with something like that, and they kind of internalize that somatic symptom in their body.
I'm going to add to what Avi said in a little bit of a different approach, because I think it's a mix of different ways of dealing with certain conditions. So if somebody gives a terminal illness, of course, we want to accept it. We want to be able to, our emotions are real. Nobody obviously should tell you, oh my God, why are you so nervous? Everything will be good. No, you're nervous. You have the right to be nervous. But let's say we're not talking about a terminal illness. As much as I like doctors and I work in the healthcare field, I've also come to realize that doctors are not God. And as much as they make a diagnosis and they go by statistics, statistics are not for everybody. And that's where, for me, and I'll give you an example to where this is coming from, for me, I definitely will always tell anybody, the first thing I cling to is prayer, hope. Is it false hope? For me, even if it's false hope, hope is better than no hope, right? So like I shared this maybe before. I remember when I was going for my 4th C-section, and of course it's high risk. I don't encourage it. I don't think anybody should do it. It's definitely a medical risk. But I remember things happened and I was going to have my 4th C-section. And I clearly remember the conversation I had. And again, for all due respect to doctors, they have to do their job. It was actually a very scary conversation where it was more like I was going to my deathbed.
What does that mean, they have to do their job?
Meaning they have to tell me the risks involved.
Oh.
It was more like I'm getting ready to go to my deathbed and not getting ready to bring a baby into the world, right? It was like, okay, I got to tell you what you're going to expect. We're planning the C-section. There's going to be surgeons. There's going to be urologists. There's going to be blood bank. There's going to be all the specialists you can think of in the room. Now, imagine I don't believe, or I don't have hope, or I don't have spirituality in me. Yeah. And I'm so nervous. It's almost like, oh my God, why in the world did I even have this baby? I'm going to die now. But what I remember at that moment when I was trying to understand what's going on, and as much as I believe in medical science and there's statistically it's a dangerous procedure, I actually feel like the first thing we turned to for me was my faith. For me, it was like, as much as I trust in my doctor and I'm under her hands, for me the ultimate doctor is the one above. For me, the ultimate doctor is the one who controls my doctor and me. So I was almost like, as much as I'm in real bad danger, it looks like, who knows, I may actually have not just a baby coming out, I may actually have my bladder coming out and all the other scary things involved. If I wouldn't be like, hey, I got God here, I got God's back, that whole process for me would be very, very disturbing. So I do believe that doctors have a lot. I am a very big advocate in really listening to medical professionals. You can listen to family members, but Find out this. I used to work, I'm sorry for talking too much. I used to work with a Russian doctor. She had a very strong personality. And every time her patients would come and tell her, doctor, my family member said this is not a good medication for me, I shouldn't take it. Her response would be, if you called an electrician into your house and he takes the air conditioner apart, are you going to stop and say, hey, well, why are you pressing that button? No, because you have no idea how this works, and that's not your job, and you believe him to finish the process and to know his job. So she says, unless your friend is in the medical field and went to medical school and learned the advice and what we listen to really can be dangerous. So I'm going to ask you, doctor, what do you do if, for example, you have a patient who has very, very few days, weeks to live? Of course, we said like there's different approaches. But now let's say there's a terminal illness. You have a patient, you're on the floor. You're actually on the floor, not an outpatient setting, in an inpatient setting, because not only does Dr. Yushuvayev do primary care, she's also a palliative care doctor, which means she specializes in end-of-life care, like when patients really have to go, to make them very comfortable. So when the patient is really, there's very, very few days to live, and hope is very, very little
You
at
said
that.
wherever these patients have to go, where are they going?
I don't know what I said.
When these patients pass away,
They're
die,
at
right?
the stage of passing
Right.
away. They haven't passed away yet.
Right.
I know every culture is different, but how do you, now you have to sit by the bedside of this patient as a palliative care doctor, and you have to start this conversation about signing paperwork, about talking about do not resuscitate, do not intubate, all these goals of care, because now it's a very serious time for this patient to really understand what's happening. What do you do about that?
Do you mean like how I go about that?
Yeah, like how do you present now this very
Yeah.
serious topic of this is very serious, you may be dying?
Most of the time, I like if I have to, do the forms or whatever, I generalize it, and I tell them, listen, I have to ask everybody these questions. Because a lot of times it takes the stress off of their situation, and they don't feel as attacked.
Yeah.
So that's very important. And first I actually talk to them for a while. I get to know them very well, and then I start these questions, and I do tell them that what will happen if, it may not happen today or this minute or the second, but in the future, if we, if let's say you reach a point in time, if your heart stops beating or your lungs stop breathing, do you want to be connected to artificial life support at end of life or not,
Yeah.
So
that's a big one, especially we're talking about do not resuscitate, do not intubate, like these type of things. And a lot of times when kids get involved, and some of the kids want to have resuscitation, and some of the kids do not want to have that, then that becomes a whole other topic. Actually, we've been getting some comments.
But
I'm reading.
I'm sorry, I don't mean to cut you off. The question was different. It was not about the forms. The question was, the patient has very few days to live, and we're not even talking about hope now. I mean, there's times where you really know the patient has, because it's really bad. Okay, let's say that based on expertise, this is really bad, and the patient asks, "Doctor, am I dying?" And this sounds very depressing. I'm sorry. What, as a medical professional that deals with palliative care, so you've seen these, I'm sure that you've come across these instances. What would you answer?
These are very challenging situations. I try to answer truthfully, but with a gentle side. But a lot of times you have to, like I said before, you have to assess their readiness to accept this information, because sometimes they don't do well with certain information.
Would that be your role to process with them, or would that be a therapist?
So we actually work with a multidisciplinary team. So before they even see me, oftentimes they have already seen the social worker and the therapist. Like oftentimes, but we all work hand in hand.
Yeah.
So, and we already know their psychology, by that point. And yeah, I mean, we run into very tough situations, but you need the different team members, involved.
Yeah, a lot of the times, and it does make a lot of sense, and this is why a lot of psychiatrists don't really do psychotherapy because, first of all, really because of insurance purposes. The insurance really kind of gave them like a 15-minute, 25-minute type of slot, so they really you can't do much of therapy in that short amount of time. So it's a lot of it is mostly medication management, looking at the medications and making sure everything is up to par and everything is going well. A lot of what you were expressing, and Doc, you can correct me if I'm wrong, is really the therapist process that with them. What it's like to be an end of life. What kind of life have you lived? What were your happy moments? What were your happy memories? What type of legacy would you like to leave? What's something that you've learned throughout this life? What's something that you've left in this life? So being able to process that and allowing them to kind of be in that state and hear them out, what kind of memories they've created, that in itself can bring them comfort. The goal is not to change, is not to fix them. A lot of the times, people assume that the therapist will come or the doctor will come, and doctors actually can fix. Therapists, don't. We're not about, fixing them and now giving them life. It's really bringing comfort to their life at that time. There was a question over here. It says, Victoria, great question. You said, great statement. You said, sometimes doctors speak to you in medical terms regarding results and etc., which can make you feel incompetent. So you ask another family member who happens to be a medical professional to be there to hear results. Does that as a doctor upset you?
No, it doesn't. I actually encourage it because, I feel that patients who are well informed, they can ultimately make better decisions for themselves. And,
I did actually hear that a lot of the times with my clients who, let's say, get a medication that they're not happy with. And when I say to them, so if you're not happy with your medication or the dose that you're getting, let's talk about advocating for yourself. If you didn't understand something that your doctor or your psychiatrist said something that you didn't understand or you're unhappy with, challenge them. This is their job. This is our job, to be challenged. If you are unsettled about something or have questions, you can absolutely ask. And I understand what you're saying, where sometimes a doctor, or hopefully, not a therapist, will make you feel like you're dumb or not smart, or roll their eyes on you, making you feel like, oh, you should have known this, right? Bring that up and say, it's like the elephant in the room. Like, if you're unhappy with that attitude and you notice that you did bring it up and it still keeps on going, or you feel they're like rushing you out and you have to go, talk about it. And if you see that it's a pattern and it's not stopping, go find another provider.
So to add to that, two things. First thing is, for anybody who does not know, every single medical facility must, by law, make sure you understand the language that you speak. So if a language is a barrier, do not allow the medical professional to simply just walk away because you don't understand English so well, so that too bad. You have to ask them to use a translator because translators are available. It's a resource, and if that's a barrier where there's a language issue, definitely utilize that. Translation is very, very, very important.
It's not even about the translators for sure, but it goes a step beyond that. Like, if you're speaking to someone and they know English and you're speaking to them in English.
Right, that was my next point.
And go ahead.
So the next thing is, if let's say English is not a barrier and you simply just don't understand the medical terminology that this doctor is using, and the doctor is rushed, I'm going to give Dr. Yushuvayev here a little plug. The reason I respect Dr. Yushuvayev is because many doctors, unfortunately, rush out of patients' room and they don't make time. And patients feel embarrassed to even interrupt and ask a question. First of all, if that's the case, really reassess if that's the kind of doctor you want taking care of you. That's number one, okay? It's like, do I really want to come to a doctor who's always rushing and doesn't explain things to me? with Dr. Alina, for example, I mean, the reason I say this is because I've worked with her. I directly worked with her. And I've seen how she communicates with patients. She never is rushing. She can have a whole schedule, and she's legit sitting and making sure that your questions are addressed. And also, if you pretend that you understand everything the doctor is saying, and you have no idea, unfortunately, the doctor cannot really read your mind.
Right.
So unless you speak up and literally say, listen, I still don't get it, they really won't know that their explanation really truly isn't at your level, because sometimes we're so used to talking medical terminology. Like we could say, how many BMs did you have? What does BM mean? Right? But in medical lingo, it means bowel movements. And you may still be like, but what's a bowel movement? Right? Like, how many times did you go to the bathroom for number 2? I mean, like, sometimes literally we're so used to talking in medical terminology amongst our own colleagues that by accident we can translate that into our patients simply because we're just so used to it throughout the day. So if you don't understand, you have to speak up, because it may not even be your doctor's fault.
You are your number one advocate. Think about it this way. The medical professionals, anybody you go see, they're getting paid. It is their job to be able to give you the service you need. If you have a question and and it's on your mind, definitely ask it. And if you don't understand, ask it again. Ask it in a way that you can understand, because when you do understand what's going on, your levels of anxiety can significantly decrease. And when dealing with a medical problem and anxiety, it's definitely a cocktail we don't want to have.
So we're actually running short on time, and I want to hear. So Dr. Yushuvayev, she doesn't usually do this whole social media thing.
It was so much fun to hear your expertise.
I was so happy and honored when I asked her if she could join our show, and she right away said, sure, that's fine. Yeah. I was really honored that you accepted this invitation. And anybody that wants to reach out to her, because again, she's a very good friend of mine, but I also respect doctors that I find very easy to communicate with. A lot of people approach me and they're looking specifically, let's say, for certain genders, like maybe for religious reasons, you want a female doctor. And I know people are going to text me and message me and say, hey, how can I get in touch with her? So just to eliminate that, her number is 718-215-0020, 718-215-0020, and her office is located in Bayside. So if you want to get in touch with her, that is the way to get in touch with her. Now, I will say something else about Avi. He doesn't know how many phone calls I get asking me for his number. I should start charging money for all these promotions.
And Yocheved's number is, are you ready? 1-800.
So just to let you know, like the amount of text messaging I get.
But you know, it is really, it's a pleasure to be able to be on this platform with both of you. And to really have a conversation with all of you guys, just to be able to say, you know, if you're not aware that you can do these things, you absolutely can. A lot of times people are embarrassed or scared. They don't want to say the wrong thing. Don't forget, medical professionals and all of them, they work for you to serve you, right? So think about it this way. And again, not to compare, right? But let's say you get a service, right? Let's say you have a cleaning person to come into your home, right? You want them to do the best job, right? And if they miss a spot, you say, hey, you missed a spot here, you missed a spot there, right? For your health, you have to do the same thing, and don't be embarrassed. Question and ask, and if you're unhappy, you ask again. Now, of course, we're not talking about a clinical situation, because that can also be where you have jumpers, where you have one person going to one doctor and then to another doctor and then to another doctor, and they never feel unsettled. That's a completely different scenario. That's not what we're talking about. The main point here is we want you to be well versed in what's going on with your life. Don't feel embarrassed. Ask away. There's no stupid questions. You know, because it's Vegas. What happens in Vegas stays in Vegas.
And I have to say, sometimes we really do have to do a lot of research on the people that we entrust our care with.
Yeah.
Just because somebody has a degree
Oh, I love that.
does
Yes,
not make
yes.
them brilliant or smart.
Absolutely.
I have seen a lot of situations where this management is completely mismanaged, patient is completely mismanaged.
Yeah.
So just really, seriously,
Right.
you really have to do your homework. Who you trust, and you'll say, well, how do I know? I mean, we trust. No, you have to read the reviews, ask questions. If something doesn't sit well with you, just know who you're asking, okay?
Exactly.
Just don't ask anybody. Ask somebody who's in the field that can help guide you. And sometimes they might say your doctor's doing something wrong, but your doctor's actually doing 100% right. It's just they're with the newer research stuff, and the doctor is already in 1970s stuff. So just really, truly pray to God to guide you, because prayer really does miracles. Prayer helps, so let God guide you. Anything else? Look at that, Edward Yushuvayev, the spouse. He's tuning in as well. Thank you so much for watching. Your wife is amazing. She really did an amazing job today, and we're so honored to have her. And Avi will now...
Victoria said, no jelly rings. We should have the dragon fruit. I feel like there's an inside joke here. What is the inside joke that I'm not aware of?
So last time I had a show, I had this amazing dragon fruit presentation, but nobody really ate it. It was just like Victoria was like looking at it and saying, if you won't touch it, I'm going to come by and eat it myself. So it's almost like, where is her dragon fruit?
Next time we will make sure to have some dragon fruit, and we should actually eat it on the show.
Yes.
All right.
Okay.
But Bukharian doctors are the best, Milana.
Yes, Milana.
Great comment.
They actually understand why we do certain decisions and why we don't listen when we're supposed to listen. Like, they know where we're coming from.
So we do have, we usually, for those of you who know our show, know at the end of every show, we have a tradition. We play a game. These are different therapeutic games that we play. So today, we actually brought 3 different games. You want to do one of each?
Let's not scare her off with the ball.
This ball is actually on stress. So talking about stress, this is a really great ball. It's a game that we play. If you want us to play the ball, let us know in the comments, and we're gonna play the ball.
We're gonna play it. I just don't think we should start with that. You know, like
so,
I think.
So let us know. Let us know if we should play this ball today, and if yes, we're gonna play it. The next game we have is called Feelings in a Jar. All right. This is another game that we play. Well, I play with my clients. There's a bunch of different cards in here with different types of feelings. And a lot of the times I will say, you know, select a card and what's the first thing that comes up in your mind. And that's the way we kind of make conversation, and that's the way we talk. What does it say here? Sure, go ahead. All right, we will go ahead. We will go ahead. And the third game I brought is called... It's called the Talking, Feeling, and Doing game. It looks like this. This one is a pretty expensive game, and it's a great way to play with children, to play with family members and friends. It's a great way to get the conversation going. A lot of times, talking about difficult feelings, and so it can also be fun doing fun things and talking about your feelings, and also just being able to talk.
Can we get through all the games?
The jar. They're saying
go
do
through
the
all
jar.
games.
Ooh, talking feelings and whatever.
See, they want all the games.
You want all the games.
Yeah.
Okay, we'll do the jar first. All right. So some of these feelings you may not even understand. They're pretty tough, but we'll get through it. Are you ready? Here we go. If you don't understand it, we'll go to another card.
Okay.
But this is what the cards look like.
So how do you play this game?
You just select a random feeling and share the first thing that comes to your mind.
So this is going to get dangerous because we have to share the first thing. We're live on camera here.
Well, let's see. Exactly, we're live. So Doc, you go first. Okay, let's see. Let's see what it says.
Delighted.
Delighted!
Hey.
So when you hear the word delighted, what's the first thing that comes to mind?
I guess happy.
Happy, right. So what's something that makes you feel happy?
Being with friends and family.
Being on the show.
Yeah.
No, being with friends and family. That's a good one. All right, you go ahead.
Okay. Grateful.
Great. Ooh, that's a good one for you.
Wow. I actually, honestly, I'm so grateful we're heading into a new year.
Yeah.
And I was telling my patients today, I want 2022 to be better than 2020 and better than 2021. I almost want 2019. So,
wait, but that's when COVID started.
I don't know. I want everything
COVID-19.
All right, 2018, whatever. That's what I'm grateful for heading into a new year.
All right, Zalman, our producer in the background. Are you ready to choose one? Should I choose one for you?
No, for you.
No, choose one.
No, he doesn't
All
want
right,
to play
ready?
the game. No, why? Don't switch. He's almost switching.
I want to give him a good one.
No, he's not playing.
Here, Fearless. Tell me something about Fearless.
My husband is camera shy.
All right. I'll go on.
Okay,
Ready? Hey, I'll go on. What is it? Provoked. Ooh, what provokes me? That's a good one. I'm not very easily provoked. It's how they say like practice what you preach. I think it's very difficult to provoke me, but once I'm provoked, ooh, you better watch your back. No, just kidding. But I don't know, provoked. I don't really get provoked. I mean, I'm sure I do, but I'm not.
I'll ask your wife. I'll have a conversation with her after the show.
Definitely ask my wife. Yeah. Maybe if I go somewhere. And sometimes, and when I'm with all my animals, and there's like a lot of kids involved, or like a lot of people, and they just like run up or do something silly. Like one time I was doing a program, and like one of the kids just like kicked one of my dogs. Oh. Out of excitement and out of wanting to kind of be next to them. That was the way he showed expression. So that kind of took me aback for a sec. But yeah. All right. So this is one of the games.
Game.
Yeah, this is one of the games to get the conversation going. All right, next. Ready?
I think it's a good game to play on a date.
On a date, really? This one? Ooh, you really find out about their feelings. All right, next. Ready? We'll do the ball. All right, Doc, you're first.
Dang.
So this is the rule of the game. Sorry, you catch the ball. You catch the ball wherever your thumb lands on. That's the question you read. She's like, absolutely not. Ready?
What did I get myself into?
Here you go.
Okay.
1, 2, 3. There you go.
Okay, left or right?
Any.
Any?
All right.
How many emails do you delete daily?
Ooh.
Oh, wow. Oh, thousands, because I have so much junk in my mail and my email.
Yeah, what's up with that?
Yeah.
There's so much junk that comes in. All
This
right.
was an easy question.
That was an easy one.
Yeah,
Yocheved.
obviously.
Okay, my
Okay.
turn. Ready? All right, let's see. If you found $5,000, how would you use it? I would give it to my wife.
Nice.
Ready?
Okay.
Here you go.
Okay. When you're busy, what's first to get cut from your routine?
Ooh. Facebook Live.
Great answer. Actually, I make time for Facebook Live. I would say when I'm busy, the first thing I try to eliminate are those, that are not so important. If I'm already very limited on my time, I have to focus on my family and very close people. So anybody else who can wait has to wait for tomorrow to get answered. That's how I do.
Wow, good for you. That's really good. By the way, 2022 will be amazing. Yes, Yelena. Good job. And Milana says she loves your dress, doctor.
Oh, thank you.
All right, next. Are you ready for the final game of tonight? This is called the Talking, Feeling, Doing game. You can buy it on Amazon. It's a great way to bring up the conversation with family, with kids, just to get everybody talking. So, Yocheved, you go first.
All right.
We have 3 decks here. It says feelings, doing, and talking. Can they see? You guys could see, right? We have 3 decks. So, which one do you want?
So we
to
get
go
to
first?
choose one?
Yeah, choose one. Ready?
Okay, I'm going to go into talking.
Okay, go ahead.
If you only had 1 month to live,
Oh my goodness.
how would you spend it? Like, this couldn't be even more perfect for the topic that we spoke about, right? And I didn't even plan this question. So if I only had 1 month to live, how would I spend it? I would spend it in making sure that anything that will take away from my joy and my appreciation of this very moment, anything other than that is going to be eliminated. I have learned that life is so short and unpredictable that every day can be your last day. Wow. So it is so important to eliminate those that don't bring you joy, to eliminate people whose conversations will always put you in a very negative toxic mood.
Mm-hmm.
So if I had 1 month to live, I would really filter out and leave only those people in my life whose presence makes me feel so happy and so appreciated and so full of life.
That's a great answer. Great job. All right, Doc. Feeling, doing, or talking?
Okay, I'll take the feeling.
Feeling. All right.
Okay. What is the worst thing you can say to anyone?
This is like perfect for a doctor.
Yeah.
You are going to die.
Exactly. Exactly. Yeah. That
Wow.
is the
So
worst
how do
thing.
you cope?
Yeah, I mean it's a hard thing to say, but you have to find the right way to say it at the right moment at the right time. But
God bless you. You don't get enough credit. Doctors, I think, like you really don't get enough credit. Thank you for what you do. Thank you for your service. Really, thank you for what you do. And here, Doc, you want to try something? Like put your hand out.
Like this.
Yeah. Yocheved, you can do it also. Ready?
Okay.
Put your hand out. Turn your hand over.
Okay.
Bring it up to your face. Give yourself a pat on the back.
Oh.
I was like, is he hypnotizing us on the show? Like, what is he doing?
No, really, thank you both for what you do.
Thank you.
Feelings. Oh man. Tell about the biggest mistake you ever made in your whole life. How do you feel about having made that mistake?
This is interesting, Avi. Wow, this is getting personal.
The biggest mistake I made in my life. This was pretty bad, and until this day I regret it. And Mom and Dad, if you're watching, I'm really sorry. I don't know how you were able to control yourself when I did this. But when I think I said the story. I'm not sure if I did.
A very long time ago. It's worth repeating the story.
So when I was about 15 years old, and I was the youngest child I was the youngest student in my classroom, and all my friends were already 16 and they were getting their permit, and I really wanted to start driving. So my mom made food for my dad, and she's like, go bring this food to your dad, to his store. And I went to his store and I brought him the food, and he had his car keys hanging there. I'm like, this is a great way for me to go drive while he's at work. And I took his car keys without him knowing, and I drove around the block. And then I see my brother, and I'm like, hey, come on in. I'm driving the car, and he's looking at me like, you took the car? And I'm like, yeah, come on in, don't say anything. And he came inside the car, sitting in the front seat, and as we made the circle, coming into the house, everything was great. I made all the right turns, and I came into the house, and he was saying, and I was coming into the driveway, and he said something to me, and I turned, and I'm not blaming him, and I turned to him, and as he was saying, and on the side of my eye, I see we're coming closer, so I pressed on the brakes, thinking it was the brakes, but it was really the gas pedal, and I drove into my house, and my parents didn't say a word, which till this day, I don't know how they controlled themselves. They didn't say a word. We ended up going out that night because I guess they wanted to make sure I was okay.
Well, there's definitely something wrong if you decided to drive like that.
Thank you over here. She's diagnosing me, right? But I definitely think that is like one of the biggest mistakes I've done. And then they fixed the car and they gave it to me for my birthday. All right, guys, this was so much fun. Thank you everybody for joining us today. Yocheved, thanks so much for creating this awesome group. Doc, really, thank you so much. What was this like for you today?
Thank you so much for having me. I really enjoyed it.
It was so much fun. So guys, stay tuned. We have a lot more exciting
Look at this.
videos.
Emma's already giving out more secrets.
Oh, you forgot about the fish. Well, I didn't say that part because the story is a really long story. There was a big fish tank with like hundreds of goldfish inside.
The car?
We went to a carnival the night before, and they were gonna throw out these goldfish, and I'm like, don't throw them out. Clearly, I'm an animal lover. I'm like, I'm gonna take all these goldfish, and I had like a 25-gallon tank, a really small tank. I put all these goldfish, and I thought like how I'm gonna distribute it. I ended up driving through these goldfish, killing them all.
Oh my God.
It was a disaster. It took me a very long time to overcome overcome that. But a lot of the guilt, I would say, there was a lot of guilt. But my mom looked in there and she's like, "You forgot about the fish." So, Mom, thanks for forgiving me. But
it was
this
awesome,
great.
Esther. Once again, if you're watching, we missed you. We hope you can join us next time.
100%.
And
And a big shout out to our behind the scenes producer, Mr. Zalman. We should give you a shout out. Where is your business located? In the city?
in the Lower East Side.
In the Lower East Side.
You need a good haircut.
You need a good top-notch
Cutters
haircut.
Barbershop.
You
Go
guys
there.
check him out.
One more time, I'll give you the phone number. If anybody's joining in and you want to see, you want to get in touch with Dr. Yushuvayev, her number is 718-215-0020, 718-215-0020.
What's her social security number?
I am
No,
not
just
going to
kidding.
give that to you. And we
All
hope
right,
you enjoy
guys.
the show.
Have a wonderful
Have a good night.
evening.
Your comments. By
Take
the way,
care.
if this is helpful, share it with others.
Yes,
Your
share,
comments.
share, 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 share.
Have a good night.
Take
Bye-bye.
care.